So we are going to be doing some provocative tests today. The first one we will be testing is Tunnel's, which is going to look for carpal tunnel syndrome. You will start by having the patient lie their hand flat. You will then tap on the carpal tunnel region of the wrist. If pain is indicated along the thumb, which is digit 1, digit 2, 3, and the medial portion of digit 4, this is an indication that they do have carpal tunnel syndrome, and it is a positive provocative test. The second test we will be doing is the Phalanx. This is also testing for carpal tunnel syndrome. You will start by having the patient put their hands in a reverse prayer position. You can also test this by having them put it in an actual prayer position, which is max extension. Pain or numbness will be indicated if this is positive. The next one is the Finkelstein test. This is going to be a test for de Quervain syndrome. You will start by opposing your thumb and ulnar deviating downward. If pain is indicated along the radial nerve, this is a positive provocative test. The next test we will be doing is the Froman's test. This is to test for ulnar nerve damage. You will start by having the patient pull a piece of paper. If their thumb remains in an extended position, this is a negative test. However, if a patient hyperextends at the IP joint, this indicates a positive Froman's test. The next two tests we will be doing are to test for tennis elbow, which is lateral epicondylitis. The first one is Cozens, and we like to refer to this as cozy because it's tucked in. So this, you will start by pushing down on the hand, and if there is pain indicated on the extensor carpi radialis longus, this is a positive test. The next one we will be testing for is Mills, and Mills is testing for pain on the extensor carpi radialis brevis. You will push down again, and if there is pain indicated, this is a positive Mills test.
This is the Hawkins Kennedy provocative test, and it looks at shoulder impingement and rotator cuff injuries. So the patient will put their arm flexed at the elbow 90 degrees and the forearm in neutral, and the therapist will internally rotate the forearm and then press it downwards and apply some pressure over the forearm. And if there is pain in the supraspinatus muscle, then it is likely indicating a positive provocative test. This is the near provocative test that looks for shoulder impingement injuries. So the therapist will support the patient's arm at the shoulder and internally rotate the arm and bring it up with maximal force as high as it will go, and then back down. And if there's any pain in the subacromial region, that indicates a positive test. This is the empty can provocative test that looks for shoulder impingement injuries and rotator cuff injuries. The therapist will have the patient bring their arm out to about a 45-degree angle and internally rotate downward. And then the therapist will apply pressure on the forearm in a downward position, and if there is pain in the supraspinatus muscle, it likely indicates a positive provocative sign.
The next test we will do is the grind test, and this is testing for osteoarthritis. You will start by the approximate CMC joint and rotate on the scaphoid. If increased pain is indicated, this is a positive sign for CMC arthritis.